Hello and welcome. Welcome, everyone. Welcome to Case Conceptualization in Marriage and Family Therapy. So, we're going to get really practical today. We are going to be looking at some of the clinical forms that accompany my textbooks. So, um, especially those of you who are in graduate programs and have to do this, some variation of this assignment, welcome, welcome. I'm gonna explain it all to you and hopefully make it really easy and really doable. So let's go ahead because we've got a lot to cover. Let's go ahead and get started. So the first thing I want to say is that this lecture is specifically designed to accompany my textbooks, Mastering Competencies in Family Therapy. There's a picture of the 4th edition. I've had a variation of this form in all of the editions. And so we'll be looking at the latest version, but this lecture will certainly help you with any of the other editions. And I also have counseling textbooks that have counseling case conceptualizations. And the truth is many of this will help with both of those. So if you need a copy of the form, you can go to therapythatworksinstitute.com/books, and you can sign up to get access to all of the forms in all of my textbooks. There's actually just one page for them all. So you can get everything, all the counseling theories, all the family therapy theories, all the treatment plans, case notes, progress notes, and case conceptualization forms. So everything is totally available for you online, free for download. So it is at therapythatworksinstitute.com/books. So enjoy. And those are very useful throughout your graduate career, as well as studying for licensing exams when you need to memorize a ton of theories. The case conceptualization forms in particular, I think, are really invaluable when having to learn a whole bunch of theoretical orientations at once. Okay. Oh, very good. Someone wants me to put it in the chat. Whoops. And I'm going to have to do that at the end of the workshop. I will put it in the chat to put a live link in there. So before we get started, I want to make it really clear because I have been working on case conceptualization forms my entire career. So I have produced a lot of them. So I want to be really clear which case conceptualization forms specifically we'll be talking about today and what are the several other ones. So today we're doing what I call the cross-theoretical systemic case conceptualization for family therapy. And this is a single case conceptualization that uses, some of the key concepts across all of the major family therapy approaches. It is a master assignment. This is really a great assignment or exercise, however you want to think about it, for doing self-supervision if ever one of your cases gets stuck, whether you're working with an individual, couple, or family, sitting down, and even if you just mentally walk yourself through this form to really think about another angle you might have missed. This is probably one of the most valuable forms I have created for what is called self-supervision, because you will sit there and kind of put all these different lenses on your case, and normally you will identify something that may explain why the case is stuck. So this is a great exercise working for individuals, couples, and families. You will see in both my Mastering Competencies in Family Therapy textbook, as well as my counseling textbooks, which are treatment planning, theory and treatment planning and counseling and psychotherapy, as well as case documentation in counseling and psychotherapy. I have theory-specific case conceptualization forms that just you're using one theory to conceptualize your client situation. So those are what I call theory-specific case conceptualizations. So that's the second major type. And then there is a third type of case conceptualization I teach, which is in my Unifying Framework Therapy That Works master course, which I teach through the Therapy That Works Institute. And there is a 4-level assessment where I synthesize all of the 50 major counseling and family therapy theories into a single framework. And so that is another way that I teach case conceptualization. So if you've been following a lot of my work, I just wanted to make sure you weren't totally confused today on what we're covering. So today what we're covering is a cross-theoretical, meaning you're going to still see the elements of specific therapeutic models in this case conceptualization form. It is quite long, which is kind of on the other end of the spectrum is my unifying framework, where I synthesize it all into one simple framework. It literally fits on one page. And so that's my kind of preferred way to do things, is to use unification and synthesis of all these different theories. However, most graduate programs and licensing exams still do, are looking at things as distinct individual theories. So I teach those in my theoretical textbooks and in forms like this and in my theory-specific forms. So much case conceptualization, so little time. Thank goodness it is so much fun, at least for me. Okay. So if you are familiar, both when teaching counseling and systemic family conceptualization, I use this 5-step map. And conceptualization is the first. So the first thing when you're working with a client in terms of just thinking about competency and what's involved in being a competent mental health clinician, the first step is to conceptualize. And this really is, honestly, the hardest part and the most important part, in the sense of this is truly what distinguishes us from your friend who's a good listener, your hairdresser, or your bartender who sit there and listen empathetically as well. There is something different that we do as mental health professionals, and that is conceptualize using clinical theories. It is the hardest part. It is the most important part, and it's really what will distinguish you from a mediocre to a really highly competent clinician. The next step is what I call identifying oases and obstacles. And so that is kind of looking at the strengths and weaknesses around the client's mental health as well as crisis assessment. And so that is the clinical assessment that I teach in a different video. Then there's treatment planning, selecting a path. Tracking progress is evaluating, if it's working or not. And so I have another lecture and chapter on that. And then finally, leaving a trail, which is documentation and the progress notes and how to write a progress note. So these are 5 different chapters in this book and also in my case documentation for counseling and psychotherapy books. And so, but these are the 5 basic steps. And the first one is to conceptualize. And that is what we are talking about today, is how to use the knowledge in the field to understand what's going on with your client and take all that information in, right? They got all these stories that they're throwing at you and all these symptoms. You're going to take it all in and you're going to use all of our counseling and family therapy theories to really understand what's the core issue that's going on so that we know what needs to change in order for the problem to get better. So that's what conceptualization is, really being able to use a very specific lens to get to the heart of the matter quickly so we can help our clients solve their problems for good. And that is what case conceptualization is all about. So in terms of mapping the territory, that is this understanding what's going on in our client's life. And it's really the art of viewing. So knowing where and how to focus your attention, what questions to ask, what to look for, what to be curious about. And so that is what case conceptualization is all about. And it's like these special it's like you can think of it as a magnifying lens that we use, or an X-ray machine probably is a better metaphor, to get below the surface and to really look not at the content at the top, but the underlying process that is what is the core issue that our clients have that need to be addressed. And that is what makes us different from others. Okay. And welcome, everyone. Welcome. Okay. So why conceptualization? So the role of the therapist is, so our job really is to promote really long-term change. Our job is not to make clients feel better. And just because your client feels better at the end of a session, it does not mean you actually did a good job. And I talk a lot about this in some of my other courses. And it relates here because, yes, we want them to ideally not feel worse at the end of a session with us. But our job really is to get below the surface stories, to get below just the emotion in the moment, and to really get to the heart and the crux of what is going on, what needs to shift for the client to have long-term change around whatever issue they have brought us to help them with. And so that really is what makes us different than friends. And so I know some people will just talk about if you're just being empathetic and reflecting emotions. I mean, that's necessary, but it's not sufficient. And there's research on that. There's another lecture I do on current work, Carl Rogers and client-centered work, person-centered work. That that empathy is just not enough to really create the change that is our job, right? And so it's really how we view our clients, how we're able to see and understand what's going on that makes us different than a friend, a hairstylist, or a bartender who listens well. And so it is through this case conceptualization that we are able to quickly hone in on what's going on, what is the underlying source of the problem, and what can we do to change it. And I see questions in the chat about the accessibility of these slides. They are available to folks in my Laugh Your Way to Licensure course. We post this all in a bonus section as part of the course. And then we post it if you belong to the Clinician Connection, and we will work on other ways to get it out. But YouTube is not a place where it's easy to post documents, and that's so this will be living on YouTube. So okay, so cross theoretical case conceptualization. So usually case conceptualization is happening in your head. It's happening mentally, as clients are talking. And the real difference between a highly experienced clinician and a new one is that you get really quick and really fast at doing this over time. And this is why filling out a form like I am going to show you, which will take a lot of time the first time you do it, you'll be shocked. The next time you do it, it'll go a lot faster. But I challenge you to fill out 10 of these if you're in graduate school, over that, years that you were in graduate school, and you will be really surprised and amaze yourself at how much faster you can get at doing all of this. But that's really the difference between someone who's highly experienced and someone's new, is that conceptualization can happen really fast with more experience. And this cross-theoretical, form that I have for you is really great in your early years, especially all the way through licensure, and learning how to use theories, and to see how they all interconnect. And so, like I said at the beginning, this form is especially helpful if you've got clients who are stuck, they're not moving, and even individual clients. And I do have a cross-theoretical case conceptualization that uses traditional counseling theories for individuals. But usually when people are stuck in therapy, they're not progressing, either their depression or their anxiety is not going better. It's usually not that you don't understand the individual dynamics. It's usually that there's something in the broader relational system or social system that is kind of reinforcing where they're at. And so this systemic conceptualization is useful for your most difficult cases, whether they're individual, couple, or family, because systemic issues are almost always what make it tough for a client to change or to maintain their gains. The classic example is with substance abuse. You can take someone, put them into a substance abuse treatment, they get, clean and sober, but you put them back out into their, home environment with their partner and their family, and usually relapse is much higher, right? And that's because of all of these systemic dynamics that make it harder to maintain gains. So this particular form is probably the most valuable for your most difficult cases. And the other thing is, if you're just using one theory in practice or conceptualizing typically from one theory, which is normally what you do for the first several years of practice, then this form is going to help you look at it from all these different angles. And normally you will see some piece that you forgot. I have even used this form and I'm feeling like, God, why isn't this client progressing more? I just kind of run it through this filter It gives me all these different angles to think about what could I have possibly missed with this client. And so it's just really helpful to step back and reflect on your case from a lot of different angles. And so this is what we call self-supervision. In terms of this is something that you can do by yourself to help you conceptualize, think through what's going on with a case, what you might be missing. So it's a very, very valuable tool throughout your career. So here is the overview of what is called the cross-theoretical comprehensive systemic assessment. Now, I should note there is a concise version because, over the years, grading this was a lot of work for my faculty, so I started shrinking it down. So there is a shorter version that you will find on the website where you download this. There's a concise version. The lecture is on the long version because this should get you through the concise version. But this is the one I use for self-supervision and recommend for self-supervision, whether you're working with an individual, couple, or family. So let's go ahead. I'm going to kind of just slowly walk you through all of this. You'll get a nice overview of some key concepts in the field of family therapy, as well as learn how to complete the form. So where to start? Who and what's going on is always where we start. So looking at who the client is and who the significant others are in their system. So even when you're working with an individual, when filling out this form, especially if you're doing it for supervision, looking at who else is in their system, their partner, their family, just so that you think about everyone in the system. I have been surprised how many times I've worked with students and supervisees, and they bring in their client, they're seeing the client individually, and I ask them, who's in the family, who's at home, and they don't even know who's in the home. Like, you gotta ask those questions. Really important, even if you're working individually, even with something like OCD, where you think it's all in, their head, and there's a lot of behavioral intervention to conceptualize what's going on. You need to know who the important people are in their lives, who is in their home, who do they interact with on a regular basis. It's key information. And so you want to look at some of the most salient demographic features. And then it's important to start by just, writing down what the presenting concern is. And you want to write down it from the client's perspective, but it is always, always, always best practice, even when you're working with an individual, to ask how the significant others in the system would define the problem. So let's say you're working with an adolescent, and let's say they're saying that anxiety is their issue and they're feeling lonely. Okay, great. You've got the client's definition, but you want to do your best to understand what the parents are saying, or what each parent might be saying about what the problem is from the parent's perspective. And even if you don't get to talk to the parents, you can ask the kid usually, or the teen, what does your mom say your problem is, or your dad say your problem is, right? So you can get it through your individual client, also with your teacher or any other significant person, your friends, right? I like to get everyone's perspective. You learn a whole lot. And usually the clients will tell you. It's not like it's a big secret. Well, my mom really thinks my issue is, or my dad thinks my issue is too much screen time, whatever, right? It's good information. Always ask and be curious about what everyone else says the problem is. It's going to give you some interesting information. I've never regretted asking what everyone else thinks that their problem is. So very, very useful questions to be asking. And then obviously making sure that you always assess for just basic background information, like, history of trauma, substance use, any immediately, precipitating events, and just the general history of the problem or other significant issues in the client's lives, just to get the big picture, right? Just get a sense of who your client is, what this problem is, how long it's been happening. So these are just kind of like mapping the territory. So when you look here, this is the form that you can download. And again, I really recommend you include as many specifiers as you can, but you want to get the client age, their gender, ethno-racial identity, and even distinguishing between someone whose family comes from, let's say an Irish background versus an Italian background. Very different family structures, very different assumptions about individually versus communal values that you might be finding. And so it's always useful to get that information. looking at their relationship status, their occupation or grade in schools, and just any other identifiers in terms of religion, language, sexuality, immigration status, economic status, education level, diagnoses, hobbies. I love to put hobbies, especially for children and at teens and adolescents, but even for adults. Our hobbies they start giving you a hint as to who they are as a person. It kind of rounds them out, and what their strengths are and what abilities and might they have that we can repurpose to help us address whatever is going on. So, clearly, if you've got a kid whose hobby is, they're on the high school football team versus on the school band, versus on the newspaper or in, art and drama, they all have very different strengths that they can bring to the table that you can draw from. So it's always useful to have that additional information there and to really put in front and center, both for you and if you're working with a supervisor, for them as well. And then in terms of presenting concern, I encourage you to think, get the description, even if it's all your client's perception of what their parents or significant other are telling them that their problems are. So even with couples, right? What their partner says their problem is always useful, useful information. And then if you have broader folks in the system like teachers or referring parties, relatives, legal system, extended family, to get their descriptions of what is going on, all of that is very useful and helpful for you as the clinician to get a good sense of what the issues are. And oftentimes you're getting, tons of information about where you need to start intervening by asking those questions. And this kind of description, multiple descriptions around the problem, really comes out of like narrative and collaborative therapy, where they talk about how every person's got a different definition and description of the problem, and understanding that is really helpful and gives you a lot of versatility, flexibility, as the clinician to know how to help folks. Then, of course, background information. This is trauma informed. So you want to start with any trauma and abuse history, and obviously if there's any treatment. And if there was abuse but no treatment, you probably are going to need to start there, and to definitely put that into your treatment goals and plans. Learning about substance use and abuse, about themselves, significant others, family members, both family of origin and current family, also very important. Precipitating events. So were there any recent life changes? When's the first type of symptoms? Are there current stressors we need to be aware of? And this related family history, right? And just historical background. So the family history, any related issues, any previous types of counseling or psychotherapy, any medical or mental health history, just kind of getting some of those, major historical elements to, again, help you get the big picture and know where to focus when working with your clients. So now the first section I have is client and family strengths and resources. And why do I do that? Because this is the reason I do this is because I've been supervising folks for over 3 decades. And one of the things I noticed when I had this section at the end, because you'll see solution-oriented assessment comes towards the end because it's kind of in historical order for the most part. I noticed that sometimes we'd go through this whole conceptualization. Oh, it was negative this and negative that, and boy, they had this problem, boy, they had that problem. And then we get to the strength section at the end. I'm like, oh my God, now I get a sense of who this person is. So I start with the strengths because it can radically change your perception and your interpretation as you're hearing all the problems, which is what the rest of this assessment is going to do. So I always start here. It helps keep a human frame on our clients. It helps us see the humanity in our clients. It helps us to have hope for our clients, which we need to have hope for them to have hope. So this is really an important section. And this is why I do it first, is that I found it made a huge difference in just my ability to have a fair, balanced, and humanizing view of my clients or the clients that my students were presenting to me. And so the importance of being able to see this is really important. And so, and to conceptualize really full spectrum, looking at personal individual strengths, such as, maybe getting good grades, they've been successful in work, they show up, they've maintained, a consistent working career path for many years. They've got a good sense of humor, whatever their individual level strengths are, and so looking at that, looking at their family, relational and social strengths, do they have a connection with anyone in their family? Do they have a social network? Do they have extended family who support them? And then also looking at spiritual resources. And so, because that can be a really important area of strength, especially if someone's going through really difficult times, things such as grief and various forms of loss, having that spiritual foundation of any kind. It doesn't necessarily have to be a religious community, but just having, beliefs in a benevolent power in the universe in some way or capacity. There's tons of research that those types of spiritual religious beliefs can really help people weather things such as grief, loss, and just those dark times that people often come to see us for. And the one thing I like to talk about, and I talk about this in all my books, is what I call shadow strengths, where every problem behavior in one context is a strength in another. For example, people who tend to be, they're coming to see you for help with, anxiety or even obsessive compulsive type of behaviors. Those, so anxiety, people who run anxious, that is a strength in another context, is they're good at planning. They're good at forecasting potential problems. They remember what to pack, they organize themselves, and they plan, right? So you want someone who's a little bit anxious to be, helping you plan out your trip and packing for your trip. Obsessive compulsive disorder, those folks, obviously in one context, that emphasis on detail and all of that, and that compulsiveness can be a problem that they need, help with. But in another context, they often are very good at details. They often cross their T's, dot their I's, right? They're reliable, consistent. So there can be, people who tend to be depressed, right? They often, people who tend to be depressed, research has shown that they are more accurate in assessing, pros and cons and challenges in a given situation. So they tend to be accurate in assessing what's going on, right? They tend to be deep thinkers. They tend to be reflective. So, every problem in one context is a strength in another, and that really becomes important when you start looking at interventions and how to address the client situation. So I always find this a great place to start. And you can do this early in treatment, and I do it often, especially when I do a lot of work with adolescents, families, asking what their hobbies are, what they're interested in, and all of that helps me think about, okay, these are the abilities that they already have in one area that we can apply to another, whatever area they identify as being problematic. So always looking for those shadow strengths because they're always there. And I've had many people tell me in reading this book, this has radically changed how they see themselves and others. This concept of a shadow strength can be a really positive turning point when that really clicks in, that any strength in one context is a weakness in another, and vice versa. Any weakness in one context is a strength in another. So here's this section so you can identify personal strengths, relational, social strengths, as well as spiritual. And then, looking specifically, given their social location, right? What unique resources or potential limitations do they have related to age, gender, sexual orientation, cultural background, social economic, status, religion, regional community, etc., right? So there can be a lot of unique resources. For example, many marginalized groups have very strong support networks, whether it's a formal religious institution, or just, groups that they're a part of, social groups that they're a part of, because they're marginalized. It's often, they often build strong social networks, right, to support one another because they need to. So yes, they're marginalized, but then they often have better support networks than those who might identify from a dominant culture. Similarly, if you live in an urban context, you can have a lot of different sorts of resources there, but it's often easier to become alienated, ironically, paradoxically, in an urban environment where there are lots of people around you than in a rural environment where people are more likely, because there are few of them, they work together and they get to know each other. Paradoxic, there are lots of paradox in being human. So this is just invites you to think about that. You and your clients to think about what are the resources and the limitations. I know some folks are very involved in their religious community, but then they do tend to avoid general, broader community organizations and events. So there's a resource, at the same time can be a limitation as well. So this just invites you and your clients to think about that. So those were all the fun parts. And now we're going to roll up our sleeves and start applying family therapy theories. And so the family structural part is the longest section of the case conceptualization. I've broken it down to several segments here of this presentation, but we start with family structure. And this is very important, whether you're working with individuals, couples, or families, to just get a sense of where they're at. So we begin by just identifying where they are in the family life cycle, because each stage of the family life cycle has different developmental tasks for the individuals and the family. And when you think of developmental, especially with family systems, we're looking at the rebalancing independence versus interdependence. How much closeness versus freedom do we have in this family system? And are we able to rebalance it at each stage along the way as the family grows, to take care of the needs of each of the individual members, both the parents and the children and extended family members. So very often families will present for treatment, or children, adolescents present for treatment when the system gets stuck, navigating from one stage to another. And probably the most common of this is navigating the stage from going from elementary age children to, teens and preteens, right? There's a whole shift in how parenting strategies all have to change. And so parents who are really great at navigating elementary school, where there's, behavioral consequences and rewards and all of that good stuff. If you're really good at that, it can be you don't transition to a whole different type of parenting for adolescents. If you find my Parenting 101 training on this, I talk about that a lot. That, it's more like mentoring, Socratic dialogue, very different parenting a teen than elementary school age kids. You will see some of that rebellious or depression or anxiety come up in the kids, if the family isn't able to successfully transition as a whole, the system is not adapting and rebalancing the independence and interdependence. So let's look at this. So here you're going to see the family life stages. You have single adult, committed couple, family with young children, family with adolescent, divorce, blended family. Obviously, you can check more than one of these boxes. And then launching, or what they call boomerang children. That means the adult children are coming back. They went to college and they boomeranged right back. Later life is almost, is more when the children are then becoming caretakers of their aging parents. And so it's really important to describe their struggles around mastering the developmental tasks of balancing independence and interdependence at each of these stages. So boundaries, regulating closeness and distance. Certainly one of the first things you want to assess, both with individuals as well as couples and families. So boundaries, we often make them sound like two-dimensional, closeness versus distance, and mesh versus disengage. But they're really much more complex than that. They are the rules for negotiating closeness and distance in a relationship, okay? So they're nuanced, they are complex. We use these generic terms, and you'll see on the form you get to check a box because that's the first place to start. But the question really is, how exactly in this relationship is closeness and distance regulated? And so And so there's boundaries both within the family, so between, parents and children, siblings, as well as between the family and the outside world. Some families are much more open. There's, lots of people in and out of their lives. Other families are much more closed, and they're very careful about who they socialize with, connect with, and let into their lives. So with couples, there's a lot, it often can be a very complex dance between how they regulate closeness and distance. And often it can be very different in different areas of their lives versus, maybe parenting versus their, sexuality versus, extended family members, versus the financial part of their relationship, right? Lots of different layers in couple relationships. Typically, so the three ways we describe them are clear, diffuse, and rigid. And all boundaries are very strongly influenced by culture, gender norms, social class, education level, all of those sorts of things. So clear boundaries would mean there are no symptoms, okay? So if everyone in the family system is clear, we would expect virtually no symptoms. So you want to be careful. Sometimes my students check all those boxes. I'm like, yeah, not likely. But diffuse is where, or enmeshed is where you're over-identified and there's pressure. If you don't think like me, then I get anxious because we all have to think the same, be the same, want the same thing, spend the same amount of time together. There's this pressure to be very, very close and similar and share lots of information. And versus rigid, where there's too much distance, there's too much freedom and independence, where it can feel, one end of that spectrum is feeling neglected. On the other end, there just really isn't a lot of emotional intimacy going on, right? Or coordinating events. And there's a huge spectrum here, lots of ways. When does it become problematic or pathological? That is not something that is actually quickly or easily defined. You have to look at what the symptoms are, look at what the structure is, and determine, at what point the boundaries are problematic. But boundaries can only be problematic if we're seeing symptoms, right? That means that there's a problem going on, because you want to be careful because there's so many cultural and gendered lenses and layers to all of this. You have to be very careful when assessing your clients' boundaries to keep the broader social cultural dynamics in mind. So here, yes, there is a checkbox because it certainly makes it easier. But, in mesh, clear, disengaged, it's a bit of a spectrum. But, putting an example out there to, give an example as to why you think it's clear, enmeshed, or disengaged. And so looking at this, and it is possible, theoretically, I think, to have some enmeshed and disengaged at the same time. But generally, it's one of these three. And you do your best to kind of, describe those here. Okay. Okay, so triangles and coalitions. So these are, you'll see these throughout all the family therapy theories, but triangles and coalitions are almost always a problem. Coalitions are usually referring to cross-generational coalitions, so a parent and child against another parent, possibly even another parent and child. I've seen a lot of family who kind of divide up into these teams that are not healthy. These aren't, but yeah, almost always problematic systems when we're using these terms in family therapy. And so there are different names. Triangulation is, when two people are a dyad are having tension, they, one or both of them draw in a third party to stabilize the system. So the classic example is you've got a couple, two parents who draw in a third child, and you can draw in that third child by one of the parents confiding and kind of complaining to the other parent to the child is a form of triangulation. Another form of triangulation is the couple focuses on that child, right? Rather than dealing with the problems in their marriage. So all of these are so there are lots of ways triangles and coalitions. Sometimes they're very obvious. Like I have interviewed families where I'm like, does it feel like they're like two teams? They're like, oh yeah, two teams in this, the boys against the girls. I've seen that one where, parents, it's cross, right? You can have a father and a daughter, and a coalition against a mother and a son. I've seen that too. I've seen it around kind of the very academically inclined versus more sporty folks in the family. There are so many ways to create triangles and coalitions in a family. So you want to, keep your eye out for these patterns. And, obviously an affair is a type of triangle. Some people would even go as far to say is that even alcohol or substances or porn can be like the third party in a relationship. So, but understanding this dynamic is really important. And if you have a couple, family, or individual who is not progressing, even though, gosh, I thought I conceptualized, I want you to spend a long time reflecting on potential triangles or coalitions that you have missed, because often these can be obvious in some cases, but sometimes they really are hidden and hard to find. And these are often this like invisible, gravitational force that's keeping the client from moving forward. So that's always a good thing to be looking at. And so here we have cross-generational coalitions. So that's when it's, parent-child against another parent typically. I have theoretically actually seen that against another child, but generally, so that's but it's generations going across generations, or coalitions with family of origin is another really common one, where you have a couple and one or both of them are more aligned with their family of origin than they are each other. And so that also can be a real problem. And then other forms of coalitions. Next, looking at the hierarchy between children and parents. And so this is a concept that comes out of structural family therapy, and it really is key in assessing parent-child relationships. And so the question is the parent-child hierarchy developmentally and culturally appropriate in this family system? What we see a lot of today, at least in the United States, is there isn't enough parental hierarchy. A lot of parents are too permissive, and you can end up with children who are very emotionally dysregulated, or their behaviors are dysregulated, children who are very anxious or depressed, or acting out. You can get all of them. So really looking at that hierarchy, not from a philosophical stance, but you want to look at the kid's behavior. And the question is, can the parent manage their children's behaviors, primarily behaviors, 90% of the time? We do not want compliance. We do not want little, mindless robots. But are the parents able to set age-appropriate consequences, limits, rewards for their children's behavior and manage their kids? And so this is really, really critical, because this is an area where, often is highly related to a lot of the problems we see in children and adolescents today. And so but you also want to consider this within a cultural lens. And let's say you're working with an immigrant family where the norm is a very kind of what we would call an authoritarian parental hierarchy, but it's culturally appropriate. Yet let's say they've immigrated to, let's say, United States or Canada, where, that is not what is supported by the general dominant culture, and the children are exposed to some very different models of what parenting and authority can look like. So there's authoritative is what they call, where there's more of a back and forth type of process, where authoritarian is, more like more absolute kind of power. So you often can find families where there is this blend of cultures and clashing of cultural values and assumptions and expectations. And it's easy to just say, well, they're here now, so they got to follow, our cultural norms. Unfortunately, human psychology doesn't work that way. So in these sorts of situations, you have to work with clients to explore those dynamics and to figure out how to get this family to define the hierarchy in a way that is consistent with culture and gender norms and all the different cultural contexts that are influencing, religious contexts that are influencing the family. So it's not a one and done. There's a simple template everyone has to use. This is a really nuanced conversation, nuanced art, and it can be really, really challenging with certain families, certainly cultural, religious norms. This can be a real challenge. And the key is to really keep the dialogue open, keep trying different things until we can figure out how to define that hierarchy in a way that works for all members of the family in a healthy way. So again, you have effective, insufficient, and excessive Authoritarian patterns are inconsistent, where you flip-flop between, especially between permissive and authoritarian. That's a really common one, and that is a really not a good one. It's a great place to start. If you have a client who, and I see this a lot too, they're permissive, 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 something happens and boom, they become authoritarian, right? And get super harsh. Then they quickly back off of that, and we're back to permissive. They back off what they said, and then they and even with couples, if you have one parent who's permissive, the other's authoritarian, you want to get them in to kind of get them on the same page, because just that contradictory messages that the kids could be getting could be the source of a lot of the stress for the individual child or the family. So looking at that issue is really critical, and it is nuanced. Even though I know I have check boxes here to help you think through it, I'm telling you, it is a nuanced art to navigate the hierarchy.